However, I am taking the another drugs of homeopathy metimidicum. That is the medicine. Name of the medicine is the Sambuccus nigra. So you are aware about it. The Sambuccus nigra is a medicine which is a medicine. The medicine which is useful in case of the disturbance in case of the sleep and the cough cold problem. The common name of the Sambuccus nigra is the elder, E-L-D-E-R. The family is the Caprifoliaceae. So I think this is the first medicine we are introducing from Caprifoliaceae family. So it is a small shrub found throughout the European countries, especially the North Africa and the Siberia region. So Sambuccus nigra, the flower is and the leaves are to be useful for the preparation of the mother tincture, especially the drug power is the half. Dr. Hahnemann was the prover of these drugs. So this medicine has some abundant usefulness of asthma, respiratory distress and other complaints. This medicine is usually especially sphere of action on the respiratory tract and other organs. So basically the Sambuccus usually gives some disturbance in the chest problem, asthma, cough, like this. And the action is usually special on the mucous membrane, results in difficulty in spasm of the respiratory tract, and there is the dyspnea, coryza and suffocating cough. Dyspnea, coryza and suffocating cough. It also produces profuse debilitating sweat, especially during waking hours. This is the very characteristic symptoms of the Sambuccus. There are so many peculiarities are there in homeopathic mathematica, even the drugs, and sometimes these peculiarities are found in the patient. Most of if we match properly between the drug symptoms and the patient symptoms, and we can expect a good result. So Sambuccus nigra is a medicine which is useful in case of the cough cold and the dyspnea and the respiratory disorder. Along with it, there is excessive sweating when happening. So in addition to that, causes an edematous swelling and of the various parts of the body and particularly of the legs. So this is a very interesting case, interesting medicine. It acts on the respiratory tract and also other part. It may be the heart and others, so that there is an edema of the lungs, edema of the lower extremity and so on. Therapeutically, it has a problem of asthma and the chest oppression. There is the coryza, cough, croup, headache, hoarseness, perspiration, whooping cough, etc. The mother tincture and potency, 6 potency mostly useful. Sambuccus is distributed mainly in the Europe country. There is the particular in the trees arises with woody trunk filled with a white metallic substances and externally covered with a rough ash-colored bark. The bark of the tree is reduced to pus for preparation of the medicine. It acts as an emetic and cathartic and is specially indicated in the rheumatism, intermittent fever, cough, angina pectoris. So its bark is most important, especially in the emetic, vomiting के लिए, cathartic, urine के लिए, specially indicated in the rheumatic problem and intermittent fever and cough and angina pectoris. If we see the causation of the drugs, there is the violent mental emotions, anxieties from different respirations, aconite, arsenicum is there. So due to the anxiety, if there is any respiratory difficult, we must consider aconite, arsenic. From sleeplessness, arsenic, causticum and colchicum. Next number, from trembling, causation, mental exam, trembling, arsenic, calcarea, natrum cub, platina and pulsatil are there. From grief, from hair falling, show anxiety from hair falling, grief, the medicine will be the phosphoric acid. From pain in head, ignitia, phosphoric acid, pulsatil and sapicaglia. From menses suppressed, the medicine with the ignitia. From the grief, if the menses is suppressed. From palpitation, grief, palpitation from grief, the opium, phosphoric acid is there. From the sleeplessness, ignitia and the calibrum and natramium, these are medicine. From chill, gelsemium and ignitia, these are the grief, chill from grief, gelsemium and ignitia. From weakness, causticum. From weakness, causticum, ignitia and phosphoric acid. Excessive sexual indulgence. From excessive sexual indulgence, the Sambuccus is also remedy. So from now we can think about the constitutions. If we see the constitutions, the physical appearance is very important. It is adapted to the persons who were formerly robust and fleshy, but suddenly becomes emaciated, and to the disease of scrofulous children with affection of the air passage especially. So appearance is very important. It is adapted to the persons who are formerly robust and fleshy, but suddenly becomes emaciated, and to the disease of scrofulous children with affection of the ear passage especially. So scrofulous children and the ear passages are especially suffered. Miasm, Shora is the background, diathesis, the scrofulous diathesis, scrofulous diathesis. Mental generals, if we see the mental generals, we will find that there is the constant fretfulness, there is the fright followed by the suffocative, attacks with the bluish and the bloated face. इसलिए हमेशा ये लोगों का एक एंजाइटी जोर इसमें रहते हैं. The constantly due to the chest problem, heart problem, other side problem, from excessive sexual indulgence, the sweating, respiratory disorder, and so on. So the face becomes bloated. The sees the images of shutting his eyes. So if we see the images of the face, there is the closeness, there is as if the eyes are closed and shutting up, there is the closing and eyes. Anxiety with vomiting with the sweat. Anxiety with vomiting with sweat. This is very important prevention. So, along with this vomiting and anxiety and sweat, if this anxiety is remain along with the sweating and vomiting, we must consider it. Okay? Physical generals. The physical generals, reaction to heat and cold. Reaction to heat and cold, very chilly patient. Okay. Sweat, while awake in the morning, general sweat, except on the head, ambulation on going to sleep. Sweat while awoke. Okay, सो गए, सोने के बाद उठने के टाइम भी उसका तकलीफ चालू हो जाता है. In the morning, sweating, general sweat, except on the head, and amelioration on going to sleep. This is the peculiarity. सोने के बाद ही उसका प्रॉब्लम चालू हो जाता है. जैसे नींद टूट जाते उसका स्वेटिंग चालू होते है. सोने के बाद उसका कंप्लेन कम हो जाता है. sleepiness, frequently awakening as due to a fright, उनका भय होते हैं, जग जाते हैं, with anxiety, trembling and dyspnea. So the patient always sleepiness. Sambuccus Nagaraka, a very uncommon peculiar symptoms of the drugs. Sleepiness, frequently awakening, off and on उठ जाते as due to a fright. So due to the fright, उसका नींद टूट जाते, even कभी कभी सांस बंद हो जाता. The respiratory disorders, there is the suffocation. Whenever he wants to go to the sleep, suffocation is there. इसलिए due to the lack of oxygen, due to the stoppage of the nose, the patient usually suffocated and his sleep or heart sleep usually disturbed. There are other medicines there. Kali group is the Kali Vicram, Max Bhomik is also there. This medicine also there. Calciflor is also there. Laxative is also there. While going to sleep, there is suffocation and other complications. Dreams of the drowning. This is very important. हमारे पास psychotic manifestation का जो भी drugs है, तुझा these drugs having the drug is sleep with the dreams by drowning. Thirst, they are thirsty. Drinks is not palatable. Okay. General modalities during aggravation, during rest, during eating the fruits, so rest aggravation and fruit aggravation. कितना टाइम? 10 मिनट हुआ, हाँ? और 10 मिनट. So amelioration, mostly aggravation during rest and after eating fruits. The china is also there, the savan is also there, and this medicine also. Amelioration, sitting up in bed. So इसलिए रात में जब कोई पेशेंट, स्पेशली छोटा चिल्ड्रन, बाय एजेड पीपल, जब भी सो जाते उसका नाक बंद हो जाता है. Due to the suffocation, he has to awaken and sit up. Sitting up in the bed and motion. Mostly the pains occur during rest and disappears during the motion. Is very important. So there is the aggravation and amelioration. Mostly the pains occur during the rest and disappear during the motion. Lustrix is there. Next number, the edematous, guiding symptoms, edematous swelling in various parts of the body. So, especially in the legs, ankle and feet, edematous swelling in various parts of the body, especially in legs, ankle and feet. There is an edematous swelling. ठीक है ना? So, it may be edematous swelling due to the heart problem or any problem. But in general, there is edematous swelling. It may be inside also, not only the extremities. So, if there is this type of symptoms along with the respiratory tract disorder or respiration difficulties, we must consider the Sambuccus nigra. That is the dry coryza, that of the infants, snuffles, the nose becomes dry, the complementary obstructed, the preventing breathing and nursing. Okay, Amonka and Nux vomica. So, dry coryza of infants, snuffles. Coraggio with snuffles. Nose dry, completely obstructed. Okay, preventing breathing and nursing. सांस लेना भी मुश्किल है. Ammonium carbonicum, नाक बंद की जरूरत है. In case of ammonium carbonicum, क्या देखेंगे हम ammonium carbonicum में? Now the patient usually takes a bottle in their hand and nose becomes stopped, and maybe sometimes coragia, the patient becomes fatty, flabby, fleshy, aggravation in going to the cold chilly patient. These are the common symptoms. And breathing, preventing breathing and nursing. If the baby becomes nursing children, you must think of this. So ammonium carbonicum and naxbomicum. Naxbomicum also having the same type of symptoms. But the peculiarity is mentality. The peculiarity is other. The naxbomicum patient is very irritable. And there is the gastric disorders. It may be constipation or the loose stools, aggravation after eating. There is the restlessness at night. Patient cannot go to sleep. The lack of the sleep, as a result consequence, so they become very irritable. You must consider these drugs. Along with it, there is the snuffles nose. There is the dyspnea. Child awakened suddenly, nearly suffocated. नाक सोने के जाते तुरंत उसका नाक बंद हो जाती है. He has to be awakened, has to be stopped, has to be sit up. The face becomes livid, blue, sits up in bed, turns blue, sits up to bed and turns blue, gasps for the breath, which is finally gets attack pass up, but it again repeated. इसलिए जब भी सोते जाते all the complaints, aggravation, suffocation problem होते हैं, he has to grasp the breath, has to be sit up and so on. The child inspires but cannot expire. This is another complaint. Child inspires but cannot expire. This is very important symptoms of the drug. So, in case of other drugs, the chlorine and mephitis. So, child can inspire but cannot expire. This is very important. If the child can inspire but cannot expire, there the gasping, there the disturbance is found. Sleeps into attacks. Whenever the patient goes to sleep, there is the problem has been started. The attacks of suffocation, as in last stage of the proof, इसलिए last stage of the proof में attack है, ये symptoms हम देख सकते हैं. Cough, suffocative with crying children. What's about the midnight? What's about the midnight? बाकी है. What's about the midnight? Hollow, deep whooping cough with spasm of the chest, with regular inhalation, but sign exhalations. Inhalation is important, but exhalation is a problem. Cough deep, dry, precedes the fever paroxysms. Along with the cough, there is a fever and paroxysms are there. Fever, dry heat while he sleeps and falling asleep after lying down without thirst. Dread uncovering cannot be uncovered in every stage. Very uncomfortable. So naxbomicum is also one of the medicines. A respiratory tract patient suffers from dry coragia. His nose is completely dry off, stopped and breathing difficult. They usually breathes through the nose. Most difficult is impossible, especially while the nursing. Next, there is severe suffocative attack of dyspnea after midnight. Arsenic is also there. Kalikab is also there. The patient wakes up suddenly, sits up in the bed and gasps for the breath. The patient becomes cyanose and turns blue in the face. The whole attacks off after some time, but again returns after a short while. The patient can inspire but cannot expire. Regular inhalation but sign expirations. The patient slips into attack. The attack of suffocation is least stage of proof. There is hoarseness with the much tachycardia. This cough is deep with proceeds for fever paroxysms. There is profuse debilitating sweat over the whole body during waking hours. This appears as soon as the patient sleeps. Next, during the fever, dry heat, and sleeps on falling asleep, the patient dreads of the uncovering, wants to cover up completely. There is no thirst during the heat and sweat state. The paroxysm provided by the dry cough. The patient may also have edematous swelling in the parts of the body, especially in the legs. Comparisons. Dyspnea inspires but cannot express. Patient can inspires but cannot express. Nephritis is there. Another is the chlorine. So nephritis is mostly available. Chlorine may not be available. Sleeps into attack. हमारे पास है lachesis. So lachesis का disease sleeps, but sleeps aggravation even during sleep, after sleep. Peculiarities of sweating. Conam, thuja, falsity. Conam एकुलर टाइम जब आए पनि तभी sweating. thuja का भी ऐसी है सोने के टाइम sweating. This one also. Dreads of uncovering max भूमिका. Fatty people emaciated suddenly. Sambuccus भी है. एक जमाने में stomach problem था. Gradually there is an emaciation. We must consider this. The medicine with the iodium and tuberculinum. The fat people usually emaciated. Iodium, tuberculinum बोले. Effects of excessive sexual indulgence, phosphoric acid and caliphos. And China, due to the height of phosphoric acid, these are the loss of the vital fluid. Tenacious mucus in larynx. So if there is any mucus discharges which is tenacious, long, stringy, and this type of, you can think of the other medicines, calibicromicum, mercury, and so on. Sleep, cannot sleep, chamomile and belladonna. Effects cold drinks whenever heated, belladonna is there. And effects of dry cold, aconite, snuffles, amonca, nux vomica, and the compatible to belladonna, cunam, nux vomica, phosphorus sepia, follows well in opium, antidoted by the arsenic, and camphor. This is all about. Thank you. Bye.